All right, we are going to move on to our next speaker, Annie Tita. And Annie is from Allina Health and Courage Kenny Rehabilitation Institute. And she is here to speak about cardiac rehabilitation, why it, or what it is and why it helps. So this is a very important aspect of the recovery. So please help me in welcoming Annie Tita.
My microphone. Are people able to hear me? Yes. Yes? Okay. Beautiful. So welcome everyone, and thank you for joining. In this talk, we're going to walk through, no pun intended, what recovery looks like after major aortic surgery. My goal is to give you a broader understanding of what it looks like to get back to life and living following this traumatic event. We'll touch on physical healing, emotional recovery, safe activity, rehab team roles, and long-term health habits. So let's get started. How do I advance? Am I? Okay. What? There we go. That helps. Okay. Can I go back? There. All right, so rehabilitation after aortic surgery. I am Dr. Annie Tita. I am a physical medicine and rehabilitation specialist, and I work for Courage Kenny Rehabilitation Institute. I am based at Abbott Northwestern Hospital, and a good portion of my role there is doing inpatient consultations, seeing patients who are in the hospital, maybe have recently undergone major surgery, and we're starting to think about next steps. How do they get better? How do they get home? And how do they get back to what they were doing beforehand? So recovery after aortic dissection or major valve surgery is a complex, multi-dimensional process that extends far beyond the initial surgical repair of the aorta. While surgery stabilizes the life-threatening issue with the vessel wall or heart valve, rehabilitation guides patients through the physical, cognitive, and emotional healing required to return to meaningful daily life. Aortic dissection and surgery often brings prolonged hospitalization, ICU stays, and periods of physical inactivity, each of which contributes to muscle loss, reduced endurance, and emotional distress. Rehabilitation, therefore, focuses on progressively restoring cardiovascular capacity, improving posture and mobility, retraining breathing mechanics, and strengthening weakened muscles. Transitioning from hospital to home can be challenging, as patients commonly experience lingering fatigue, pain, and fear of overexertion. Structured rehabilitation provides reassurance, pacing strategies, and education so that patients can resume activity safely. Importantly, emotional recovery is just as significant as physical healing. Anxiety, fear of recurrence, and cognitive changes such as brain fog or slower processing are highly prevalent. Rehabilitation professionals help normalize these experiences and provide strategies to cope effectively. The overall goal is to reestablish independence and confidence while preventing complications. Long-term recovery also includes adopting heart-healthy behaviors, such as regular moderate exercise, blood pressure control, and avoiding activities that excessively strain the cardiovascular system or cause unsafely elevated blood pressure. Because each patient's dissection severity, surgical history, and baseline health differ, rehabilitation must be individualized. Recovery after major aortic surgery is a long process, and patients often need reassurance that ups and downs are normal. Aortic dissection creates a sudden and profound disruption to both physical and emotional well-being. Physically, patients often face long ICU stays, chest or back discomfort, reduced stamina, and limitations in lifting or overhead movement due to discomfort, surgical healing, and reduced cardiovascular tolerance. Many people experience temporary impairments such as difficulty walking, especially long distances, shortness of breath, and generalized weakness caused by the prolonged bed rest. Emotionally, the unexpected and life-threatening nature of the event often results in shock, anxiety, and lingering fear about recurrence. These emotional reactions may intensify when patients attempt to resume activities and feel uncertain about what is safe. Cognitive challenges, commonly referred to as brain fog, may include slowed processing, memory lapses, or reduced attention. These are often related to the physical stress of surgery, anesthesia, ICU delirium, or periods of reduced blood flow to the brain during the dissection event or surgery. Family members may also struggle worrying about their loved ones' safety or misunderstanding the pace of recovery. Rehabilitation plays an essential role in addressing these concerns, helping patients understand expected symptoms, guiding physical activity safely, and reassuring them that emotional and cognitive changes are common and usually improve with time. Rehabilitation is essential because the recovery journey involves far more than healing the surgical incision. After an aortic dissection, the heart, lungs, muscles, and nervous system are all affected. Surgery restores structural integrity, but the body still needs systematic retraining. Cardiovascular endurance often declines due to prolonged inactivity and the physiological stress of surgery, requiring gradual reconditioning through monitored aerobic exercise. The musculoskeletal system also undergoes significant changes. Muscle weakness, stiffness, and altered movement patterns are common, particularly around the chest, back, shoulders, and neck because of surgical positioning or sternal restrictions. Rehabilitation introduces posture correction, breathing retraining, and movement strategies to prevent long-term limitations. The nervous system, meanwhile, undergoes heightened stress from pain, fear, and the traumatic nature of the event, which can result in anxiety, hypervigilance, or avoidance of activity. Guided rehabilitation helps patients understand which sensations are normal and which require medical attention, minimizing fear-based inactivity. Early rehabilitation has been shown to reduce complications such as deconditioning, respiratory issues, and hospital readmissions by promoting safe mobilization, blood pressure awareness, and functional independence. It also supports emotional recovery by providing structure, reassurance, and gradual support to physical activity in a supervised environment. Ultimately, rehabilitation empowers patients to engage actively in their recovery, regain autonomy, and develop healthy, lifelong movement and self-management habits. Early recovery after aortic dissection frequently brings a collection of predictable symptoms that can feel overwhelming if patients don't know what to expect. Fatigue is typically the most universal experience, often lasting weeks as the body repairs itself and gradually rebuilds endurance. Chest, back, shoulder, or neck pain and tightness are also common due to the surgical incision, tissue healing, muscle guarding, or altered posture during the recovery period. These sensations are usually not signs of new damage, but reflections of normal healing and temporary biomechanical changes. Shortness of breath may occur with mild exertion because the cardiovascular system is still adjusting, and the lungs may be recovering from anesthesia effects, and the chest wall may feel stiff. Activity restrictions, especially related to lifting, pushing, pulling, and overhead movement, are designed to protect the healing sternum and prevent undue strain on the cardiovascular structures. Understanding them helps reduce anxiety. Emotionally, patients may experience fluctuating moods, fear of recurrence, tearfulness, irritability, or feelings of vulnerability, particularly after leaving the structured hospital environment. Sleep disturbances are common due to discomfort, altered routines, and lingering stress. Recognizing these symptoms as expected helps normalize the experience and encourages adherence to the rehab guidance. Most importantly, early recovery should emphasize pacing, gentle activity, and open communication with the care team to ensure steady progress while avoiding complications. Most patients after an open repair will follow sternal precautions, so we'll introduce them here. Sternal precautions are temporary guidelines designed to protect the sternum as it heals after being surgically opened for access to the heart and thoracic structures. These precautions vary by institution, but generally aim to prevent forces that may disrupt the bone or wires holding it together. Patients are typically asked to avoid lifting more than 5 to 10 pounds, as increased load through the arms can transfer stress to the healing bone. Avoiding strong pushing or pulling movements, such as opening heavy doors, forcefully using armrests to stand, or vacuuming, is equally important because these actions place tension across the chest. Restrictions on reaching both arms overhead simultaneously or reaching far behind the back help reduce strain on the sternum and minimize discomfort. These guidelines allow bone healing to progress safely and reduce the risk of complications such as sternal instability or delayed union. Patients often fear moving because they misinterpret normal post-surgical sensations as harmful. Therefore, education is essential. Rehab professionals teach how to modify movements, maintain good posture, and use the legs rather than the arms for major transitions like going from sitting to standing. Ultimately, sternal precautions are not meant to limit independence, but to support safe, confident movement while the sternum regains strength during the early postoperative phase. Safe movement strategies are a cornerstone of early rehabilitation after aortic dissection and surgery, helping patients remain active while respecting sternal precautions and preventing undue strain on healing tissues. One essential technique is the log roll method for getting out of bed. Patients roll fully onto their side, move their legs toward the floor, use their core and lower body to rise rather than pushing up with their arms. This technique reduces chest strain and enhances comfort. Standing up from a chair should involve scooting to the edge of the seat, planting both feet firmly, leaning forward slightly, and using the legs to rise up while keeping arm pressure very light or minimal. Reaching tasks should be adapted by keeping the elbows close to the body and bringing objects toward the patient rather than extending the arms outward or overhead. Activities like opening heavy doors, lifting full laundry baskets, or carrying young children should be avoided in early recovery because they often require forceful arm use. Rehab professionals may recommend specific tools such as reachers, shower chairs, or long-handed sponges to reduce strain during certain daily tasks. By learning and practicing these strategies, patients build confidence, maintain independence, and lower their risk of complications as they transition back to daily life. These adjustments are temporary for most patients and gradually ease as the healing progresses. Returning to physical activity after aortic dissection must be approached gradually and intentionally to promote cardiovascular healing while preventing complications. In the earliest phase, gentle movement such as short, frequent indoor walks is preferable to prolonged or strenuous activity. The goal is to build tolerance slowly, allowing the heart and circulatory system to adjust without excessive blood pressure spikes. Patients should monitor for symptoms such as chest discomfort, severe shortness of breath, dizziness, or palpitations, which may indicate the need to stop and rest or consult a clinician. As endurance improves, walking distance and intensity may be increased incrementally, but pacing remains critical to avoid overexertion. Structured guidance from rehab professionals ensures activities are matched appropriately to a patient's healing stage. Breathing techniques such as avoiding breath holding, maintaining steady exhalation during exertion, help regulate blood pressure during activities. Many patients benefit from using perceived exertion scales to judge intensity rather than relying primarily on speed or distance metrics. After several weeks with medical clearance, patients may transition into a more formal cardiac rehab program or light aerobic exercise routines. This slide introduces the role of a formal cardiac rehabilitation program. Cardiac rehab is a medically supervised program designed to help patients safely rebuild cardiovascular strength and endurance after major cardiac events, including aortic dissection. These programs combine monitored aerobic exercises, strength training tailored to sternal healing, education on lifestyle practices, and emotional support. Continuous monitoring of blood pressure, heart rhythm, and exertion levels allows clinicians to adjust exercise intensity and detect any abnormalities early on. Participation has been shown to improve survival rates, reduce hospital readmissions, and enhance quality of life by building long-term exercise habits and improving functional capacity. Patients often report increased confidence when exercising under professional supervision, especially when they have fears about triggering symptoms. Education components covers topics such as medication adherence, blood pressure controls, nutrition, and stress management. Emotional health support is also integral. addressing anxiety, depression, or trauma-related stress that may develop after a life-threatening medical event. Cardiac rehabilitation provides a structured, comprehensive environment for recovery that bridges the gap between hospital discharge and independent community-based activity, making it very valuable for long-term recovery. Recovery after major aortic surgery is supported by a team of rehabilitation professionals, each contributing unique expertise. Physical medicine and rehabilitation, PM&R physicians, also known as physiatrists, oversee the overall rehabilitation plan, addressing complex functional issues, managing pain, evaluating neurologic changes, and coordinating therapies. They are especially important for patients with significant complications from prolonged ICU stays, neurologic involvement, or profound deconditioning. Physical therapists focus on restoring mobility, improving endurance, correcting posture, and teaching safe gait and movement techniques. They guide patients through progressive aerobic training and strengthening regimens that are tailored to sternal precautions and cardiovascular limitations. Occupational therapists, or OTs, address activities of daily living such as dressing, toileting, bathing, meal preparation, and home safety. They teach energy conservation strategies, recommend adaptive equipment, and help patients regain independence in routine daily tasks without violating lifting or reaching restrictions. There's natural overlap among these professionals, all of whom work to enhance patient safety, autonomy, and confidence. Their coordinated approach ensures that physical, functional, and cognitive needs are addressed holistically throughout the recovery journey. Some patients recovering from aortic dissection face additional challenges that require a modified rehabilitation plan. Complex or repeat surgeries may involve prolonged time on cardiopulmonary bypass, multiple incisions, or graft revisions, which can increase pain levels, prolong healing, and require extended sternal precautions. Long ICU stays contribute to complications such as ICU-acquired weakness, also known as critical illness myopathy, delirium, or respiratory difficulties, each of which influences rehabilitation pacing. Neurologic symptoms, including spinal cord ischemia or stroke, may impact mobility, balance, or cognitive functions and require a more integrated neurorehabilitation strategy. Patients who require prolonged mechanical ventilation may experience residual breathing impairments or weakened respiratory muscles, making breathing retraining a crucial part of therapy. Pre-existing conditions such as heart failure, peripheral vascular disease, or diabetes may further affect strength, endurance, and wound healing, or blood pressure control. Rehabilitation, therefore, must be highly individualized, prioritizing safety and realistic goal setting. Through coordinated care, therapists and physicians adjust intensity, provide adaptive strategies, and ensure patients and families understand how these special considerations influence recovery timelines and expectations. That being said, the next slide goes through the typical expectations for recovery milestones, because that's very often one of the first questions that patients or families are asking about as we are discussing their post-surgical recovery. Recovery timelines after aortic dissection vary widely depending on surgical complexity, baseline health, and individual healing responses, making personalized expectations essential. Walking and light exercise typically begins within days to weeks, starting with short distances and gradually increasing as endurance improves. Most patients experience noticeable gains within the first 6 to 12 weeks. Driving is generally permitted 4 to 6 weeks after surgery, provided the patient is off narcotic pain medications, has adequate neck and shoulder mobility for turning safely, and can perform sudden braking without chest discomfort. Sternal precautions may impact this timeline. Returning to work depends on the nature of the job. Sedentary work may resume in as early as 4 to 8 weeks, whereas physically demanding occupations may require 3 to 6 months or even longer. Sexual activity is often considered safe when a patient is able to climb 2 flights of stairs without significant symptoms, and low-strain positions are recommended initially. Caregiver responsibilities, such as for children, must be adapted early on, especially when lifting or physical assistance is expected. Patients should avoid lifting more than 5 to 10 pounds early in the healing period. Importantly, Comparisons to others can be misleading, as each recovery is uniquely influenced by the surgical details, complications, emotional state, and overall health. Now we'll focus a little more deeply on the emotional and cognitive side of recovery. Emotional and cognitive recovery is a major but often underappreciated component of life after major aortic surgery. Many patients report brain fog, characterized by slowed thinking, memory lapses, difficulty concentrating, or challenges with problem solving. These changes can result from factors such as anesthesia effects, ICU delirium, temporary disruptions in blood flow to the brain during the dissection event or surgery, or the overall physiological stress of the surgery. Emotional symptoms are equally prevalent. Anxiety about recurrence, heightened awareness of the body sensations, depression, irritability, and sleep disturbances are common. Post-ICU stress reactions may include nightmares, intrusive memories, or hypervigilance. These experiences can affect confidence, independence, and social interactions. Importantly, these symptoms are normal responses to a traumatic medical event and typically improve over weeks to months with support. Rehabilitation teams help normalize these reactions and provide coping strategies such as structured routines, gradual cognitive challenges, relaxation techniques, and referral to counseling or support groups whenever necessary. Family members should also be educated to recognize emotional and cognitive fluctuations, respond with patience, and encourage open communication. Addressing these aspects of recovery enhances overall function and long-term quality of life. Families play a central role in recovery after major aortic surgery, offering both practical assistance and emotional support. One of the most effective ways families can help is by encouraging pacing. This means supporting the patient in staying active while helping them avoid overexertion. Joining on walks or participating in home exercise routines can provide companionship and reassurance. Families can also assist with physically demanding household tasks such as laundry, vacuuming, grocery shopping, cooking, or yard work during the early phases of healing, while still promoting independence in lighter activities. Emotional support involves acknowledging the patient's fears, validating the challenges of recovery, and recognizing that mood swings or anxiety are common and temporary. Attending medical appointments or rehabilitation sessions together can help reinforce instructions, aid memory, and improve the continuity of care. Families should learn to identify red flag symptoms requiring medical attention so that they can respond quickly if needed. Celebrating small milestones, such as increased walking distance or completing daily tasks more easily, helps boost confidence and morale. A collaborative, supportive environment empowers patients to progress safely through their recovery journey and enhances long-term outcomes. Long-term recovery is really about building sustainable, heart-healthy habits. Lifestyle planning after aortic dissection focuses on maintaining cardiovascular health while preventing activities that excessively strain the newly repaired aorta. Regular aerobic exercise such as walking, swimming, or cycling supports heart health, reduces blood pressure, and improves endurance. The intensity should remain moderate, avoiding extreme exertion that could cause sharp blood pressure spikes. Strength training is safe when approached gradually with low weights and higher repetitions, emphasizing proper breathing to avoid the Valsalva maneuver, which can drastically raise intrathoracic pressure. Blood pressure management during activity is crucial. Patients should avoid heavy lifting, competitive power activities, or high-intensity interval training unless specifically cleared by their cardiologist. A heart-healthy diet, smoking cessation, medication adherence, and maintenance of a healthy weight further reduce long-term risks. Regular imaging of the aorta ensures early detection of changes in the surgical repair or the remaining aortic tissue. Activity should support, not limit, patients' quality of life. Learning to stay active without fear or unnecessary restrictions is a key goal of long-term rehabilitation. This final content section reviews warning signs to be aware of. Recognizing red flag symptoms is essential for patients and families after aortic dissection, as prompt medical attention can be life-saving. Sudden severe chest, back, or abdominal pain is a critical warning sign that may indicate changes in the aorta or other acute complications. New or worsening shortness of breath could signal heart failure, pulmonary issues, or complications related to blood pressure or fluid balance. Fainting or near fainting episodes requires immediate evaluation, as they may reflect arrhythmias or significant blood pressure instability. Rapid or irregular heart rhythms, especially if accompanied by dizziness or discomfort, also warrants urgent assessment. Neurological symptoms such as numbness, weakness, difficulty speaking, facial drooping, or vision changes could indicate a stroke or spinal cord involvement and requires emergency care. Swelling or pain in the legs may suggest the presence of a deep vein thrombosis, which poses a risk for pulmonary embolism. Additionally, signs of infection around the surgical incision, such as redness, warmth, drainage, or fever, should prompt notification of a clinician. Patients and families should err on the side of caution, as early intervention can prevent severe outcomes and ensure safe, continuous recovery. So, in conclusion, surgery fixes the structures, but rehabilitation restores function and quality of life. Recovery is not just healing the incision. Sometimes the hardest part of recovery is everything that happens outside of that. Early guided rehabilitation lowers complications and supports long-term independence. Rehabilitation includes addressing the emotional and cognitive recovery. Safe exercise after aortic surgery involves learning how to stay active without becoming overly restricted. Cardiac rehab is a medically supervised program designed to help people recover after a heart attack, heart surgery, or other heart-related events. It is a comprehensive team-based approach that combines physical activity, education, and emotional support to reduce the risk of future heart problems. And every individual's journey is unique. So, thank you for your attention.
I want to thank everyone for attending today. Thank you to, obviously, all the providers and speakers that were here today. Thank you for attending. Thank you for all the great people and partnerships that we've made over the years that has helped make this possible.